is on the woman. The
Yeah.
second you're married, all the pressure is on the woman, like
Yeah.
from parents to in-laws to your bua, chachi, everybody saying like, where is the kid? And nobody's talking about all the other biological things that kind of come along with it. So what are your 2 cents on that, Dr. Soni?
Yeah, yeah, very true, Kopal. So the basically in India, like a male-driven society, the diagnosis and treatment of male infertility is still entangled with lot of cultural stigma and gender bias. So when it comes to the male infertility, there is a lot of reluctance to seek help.
Hmm.
Like people usually don't even undergo a very basic semen analysis test. I have seen a lot of couple, like I have a lot of examples where I see that the female is undergoing extensive testing and even invasive treatment also without doing a very simple semen analysis test. Because sometime in a male driven society, as I told, like in India, people think that that male infertility is wrongly like interpreted as a lack of manhood. So there is a lot of shame, denial, and obviously there is a lack of testing also.
And do you have like patients walk into your clinic where the husband is like refuses to take a test or says that it's not my problem to deal with? Do you get some of that as well when
Yeah,
you're being?
yeah. It is because of lack of awareness. So there
Yeah,
is a infertility in India is still considered as a woman problem.
correct. Yeah.
People, as we know, as a fertility specialist, we know that half of the cases are because of male infertility also. So people, sometime I have seen, as I told, that I have seen a lot of example where if the female has undergone extensive testing and even the treatment without doing a very basic semen analysis test. So it is because of lack of awareness. People think that infertility is just a female problem, it is not a couple problem. So the society or the couple should be aware about this thing. They should be told that it is a male plus female problem. 40% of the infertility cases are because of male problem, and that is not even diagnosed sometime.
Right. And Carl, what about your experiences in the West? Do you face a lot of this there as well? Like when you walk into these fertility clinics or when you speak to your peers, for instance, do men feel the same way as they do here in India, where they feel like it's the woman's burden to take and not theirs?
Well, I think that the common misconception is because I have semen, I can have kids. So
Yeah.
most men experience the semen experience where they experience. So the concept is, well, I can have kids. No one ever thinks about the sperm involved because we don't know the difference. I know the difference. I thought semen and sperm was all the same thing. So I thought, well, as long as I can ejaculate, then I can have kids. It's that knowledge that people don't know. There's two different fluids. Sperm is a cell and semen is the fluid. But once again, because people don't know that, the assumption always is because I produce semen, then I can have kids. Once we get the message out there that it's not taught readily, in the states, sex education. Sex education is very taboo and very limited when they talk about it. So that's a very detailed process. So once again, most men, including me, think because I produce semen, I can have kids. You think that if nothing comes out, then that's where I'm
That's very true.
into
That's very true.
infertile.
Because people misinterpret, I mean, sexual performance with fertility. They
Yes,
feel that if the male is sexually active, he is normal. That means he is fertile.
yes. Being unfertile, you would think, well, if nothing comes out, that's when I have it, but that's not the case, and that's where we need to educate more. Whether something can come out, it just it doesn't have sperm attached to it, or is that sperm viable? Those are the things that I want to educate people on. Yeah, because I even had people joke with you all the time, like, so you were shooting blanks. It's like, not quite. You hear these jokes, you hear them, because that's the conception that nothing coming out. But yeah, and once again, when you think that something's coming out, then if you're ejaculating, that means I can have kids. But it just educate people. No, it's a little bit more than that, a lot more than that.
Right. So what I'm hearing, like if we just take a two steps back, it's just lack of awareness to a very large extent.
Yeah.
People don't know, and usually people get to know when the problem is right in front of them. They don't know beforehand. So like just to take a quick detour, what do you think are some things that we can actually do to spread this awareness? Like, of course, this podcast is, for example, one thing that we can do. But what are some other ways in which we can actually reach out to probably like newly married couples and tell them that, there is a large part, I mean, I don't know the percentages, probably, you would. What that there's a large chunk of population that is dealing with this issue. And these are the things that you need to be prepped for. This is the kind of mindset that you need to have. Could you give me some of your insights or your learnings on these? And the question is for both of you.
Yeah, so actually, we should focus on the awareness. I mean, mainly we should focus on the male reproductive health also, which no one is speaking about. So even if we say about the school education, the public health messages, and even the fertility clinic, if you see the fertility specialist, there are very few male fertility specialists and andrologists, because always male are not comfortable sharing their personal problem with the female fertility specialist.
Right.
So we should provide the education around male fertility, around the male risk factor. We should make them aware that alcohol, smoking, their obesity, their lifestyle factor, everything is affecting the semen quality. So and that in short is affecting their success of getting pregnant. So we should create a environment, we should create a male comfortable environment. We should educate them that male infertility is also equally important as the female infertility.
Yeah. Yeah, definitely educating. If also if people explain the experience, it's an interesting experience when you go through the semen analysis. Um, I in my book I talk about it and I make a joke about it because when I go to the clinic to do the semen analysis, my thought was everyone's looking at me and everyone knows why I'm here. I think it's like this bell went off and the siren, like, here he is, here he is, here he is, the guy who's getting his semen. He can't, you know what I mean? You have those thoughts in your head. And, when you go back, the nurses take you to the back and they take you into a room and then you have to like do all these thoughts are going through your head about everyone's looking at me. And then when you come out of the room, everybody's like, there goes the guy right there. And that was so far from the truth. No one even cared because they're professional. They do it all the time. And once you kind of get over that, I talk about in the book, they truly don't care. They're professionals. If you were doing a blood sample, if you were getting a hair analysis, it'd have been the same kind of experience. And that's what I talk about in the book once again, that they're total professionals. So you'll never feel uncomfortable. Anytime I felt uncomfortable, it was in my head. So getting that ahead of me and realize like no one's judging you in there. They see 1,000 men a day. You're number 1,001. So that's kind of what I did in my book. I wanted to get the stigma out there, like truly, truly. It's just like any other experience, any kind of other medical experience. No one knows. No one's looking at you. Everyone in there is mind their own business. So once we can get past that stigma of the process of getting the semen analysis done, I think more men will feel comfortable with getting it done. No one knows why you're there. They have a clue. But once again, it's all in your head, it's all in my head. And I joke about it in the book because it really was. No one cared.
Right. Yeah, it's just about normalizing it, like treating it like you said, any other medical procedure that you'd go through. Like that is exactly what it is. But I think a very important part of it is education, right? So, Dr. Sonu, we've of course spoken about the semen analysis, which is kind of the first step to just taking that test. Could you take us through that journey, like from that testing to the embryo transfer? What does it look like? What is that? Can you just basically, in a very layman, audience friendly terms, you could just explain our technology to us?
Yeah. So first
Yeah.
of all, I will explain that what all we need to get pregnant. So basically, there are four things which we need. We need the semen analysis, we need the egg, we need the uterus, and finally we need the fallopian tubes also. So we have to investigate these one by one. In
Right.
case of female, we should do an AMH, that is a very simple blood test, that is anti-Mullerian hormone, that will be telling me the ovarian reserve. That means the number of the eggs the female is having. The second very simple test, as we know that the contribution from both male and female. So from the male part, we should first do the semen analysis, which is also a very simple test, which is done with with an abstinence of 2 to 5 days. The male has to give the semen sample. We do a basic microscopic examination of the semen sample, seeing the sperm count, the sperm motility, and definitely the morphology, because these three features are very important for a sperm to fertilize the egg. The third thing which you should be doing in a female is a basic ultrasound to see her uterine health, how her uterus looks like, because we know uterus is a womb for the baby. So the baby has to grow inside the uterus. So we should see the health of the uterus also. If all these three things are normal, the egg is normal, the sperm is normal, the uterus is normal, then we should investigate the tubes also for the female, because tube is a part in the female reproductive tract where the egg and sperms fertilizes. So the tube should also be open. So these are four very basic testing which should be done in every couple when they are coming to a fertility specialist with infertility. So, depending on the situation, whether the problem is with the sperm, whether the problem is the egg or the fallopian tube or whatever, if we decide that we have to do IUI or IVF. So, IUI is a very intrauterine insemination, is a very simple procedure where at the time of ovulation, the male semen sample is taken, it is processed, the motile, good, healthy looking sperms are injected directly inside the uterus so that the egg and sperm can fertilized and can form an embryo. If I come to an IVF, that is in vitro fertilization. So as the terms indicate, is a in vitro fertilization. The things, I mean the fertilization which is happening inside the fallopian tube during natural conception, in IVF it is happening outside the body. So we are giving some injection from day 2 of the period to the female to stimulate her ovaries to produce multiple eggs. When the eggs are mature, we are extracting the egg, we are taking the male semen sample, we are choosing the good quality sperm, we are fertilizing egg and sperm, we are observing the embryo in IVF lab for the 5 days to select the best quality embryo. And finally, when we get the good quality embryo of the 5 days, we are transferring this embryo inside the female uterus. So, this is the part of embryo transfer.
Wow.